My name's Jordan Hillam and I'm with Hillam Orthodontics. Today we're going to talk a little bit about expanders. So expanders are used to make the upper jaw wider, okay? So your maxilla or your upper jaw has a right side and a left side, and in the middle is a soft spot, kind of like babies have soft spots on their heads when they're born, and that soft spot can stretch. So we can actually make your upper jaw bigger than it is. And we do that in a number of different ways for a number of different reasons, but there's four main reasons that you'd want to expand your jaw. One is to fix a crossbite. So a crossbite is where instead of your upper teeth being over the lower teeth like this, crossbite is where they're on the other side, right like that. And we want to fix that because if you have a crossbite, your jaw will shift, you'll have abnormal tooth wear, and that's something that you want to fix right when you see it. Second is to gain space for all of your teeth. Sometimes you have a lot of crowding, you just need more room to fit those big, beautiful teeth in there. The third reason to expand is if you just want a cosmetically bigger smile, like a Hollywood, nice broad smile. And there's a lot of times we do it just for that. And then lastly is to help the airway. We tend to breathe better if our upper jaws are developed better. Now, with those four reasons to expand, there's many different ways to expand, but I'm going to talk about four different appliances that we use to expand. First, this is a removable appliance, okay? Now, this is a little retainer, and we call it removable because it can go in and out of your mouth. And that's great because you can take it out to clean it, but you can also take it out and lose it. And the number one place these things are lost are at school. So we tell them not to take them out at school. But removables are awesome. They're really simple to make, but they don't necessarily get the very best expansion. They work better when you're younger. The second type of expansion is called a bandid appliance. And banded means there's just four rings that go around your teeth, and those rings act as handles that we use to push your teeth in your jaw wider. This actually glues in your mouth, it doesn't come out, and we use this probably a majority of the time. Then we have what's called a bonded expander. And the difference between this one and the last one is that this one glues to your teeth. So it just glues to the surfaces of your teeth, and then we expand really well. We use these a lot with the younger kids, especially if we struggle to fit bands on their teeth. And then lastly, we have what's called a Marpy. And this isn't made yet, but this is what we make it out of. And a Marpy actually, it doesn't just hook to your teeth, it actually hooks to your bones. But with a Marpy, you can expand actually in adults. So if you have adults that come in, they have a narrow jaw, or they want a broader smile, we can expand from them nowadays with a mini screw assisted rapid palatal expander. So those are the four main ways. There's other ways to expand as well, but I think the main thought is if you have a crossbite, if you have issues breathing, if you want just a broader smile, or if you have a lot of crowding, those are four reasons to really look at doing an expander. So that's all I got.